So my name is Dr. Narjust Florez. I'm a thoracic medical oncologist at Dana-Farber Cancer Institute, Harvard Cancer Center. I specialize in young patients with lung cancer, particularly young women with lung cancer. And the question is why you're specializing in young patients with lung cancer. So lung cancer in women incidence continue to increase every year, particularly in young patients. And we define patients as patients less than 50 years old. And we have seen since 2018, more young women are getting lung cancer than men. And what is the issue with that? Unfortunately, gender bias plays a big role here. Women are often ignored, excluded, when it comes to understanding lung cancer and to participating in clinical trials. So when a woman goes to see a doctor and has concerns about lung cancer, it takes almost 3 times as long to be diagnosed with lung cancer compared to a man with the same risk factors. This is not new in medicine. Gender bias has affected diagnosis in women since we remember. So women first are ignored, leading to delays in diagnosis, leading to be diagnosed with stage 4 mostly. Second, when it comes to lung cancer screening, the women that qualify for lung cancer screening, particularly women of color, are 6 times less likely to be offered lung cancer screening compared to men. Let's keep talking about how many times our women are excluded. Clinical trials. Clinical trials here in FASCO led to the changes of treatment, how we develop treatments. And for many patients is the opportunity to get early access to new drugs and new combinations. Women are often excluded for most lung cancer clinical trials, even when the mutation is more prevalent in women. So for immunotherapy trials, 65% of the participants have been men. And people tell me, oh, that's back in the day, that doesn't happen anymore. Well, it's still happening. So the immunotherapy, chemotherapy trials for lung cancer in early stage that have been published in the last 2 years, including one in the last 3 weeks, 73% of the participants in those trials were men. So it's excluding the majority of patients because there are more lung cancer survivors are women than men, and they're being excluded for trials, and then when the drugs get approved, we don't really understand the drugs in women. And women are experiencing more side effects, and then gender bias comes again. Oh, they're just complaining. It's not true. Women are 11% less likely to report side effects than men. But what happened is we didn't test the drugs in women. So we're learning about the side effects after the drugs are approved. Let's talk about end of life. End of life in women with lung cancer is also an issue. They tend to have 3 times more social responsibilities even when they have very limited time on earth. They're less likely to be visited by hospice nurses. They're less likely to be referred to hospice on time. So we continue to follow women with lung cancer. And I'm wearing this pin today to increase the awareness about lung cancer. This is part of my initiative called LEAD, which is to stop delays in diagnosis in women, to include women, and to see lung cancer as a disease of women. And I hope that I will continue to improve awareness and that all the women across the globe are heard, are diagnosed on time, are included, and are cared for.